Today we'll be talking about how to read blood pressure off an individual. First, we'll need a sphygmomanometer that consists of a cuff, inflation bulb, aneroid gauge, and a single stethoscope. To begin reading your patient's blood pressure, first you want to make sure they're seated quietly on a seat with back support with their feet flat on the ground and one arm supported at heart level. After your patient has sit quietly for at least 5 minutes, go ahead and grab the deflated cuff and wrap it around his upper arm. When grabbing a cuff size, you want to make sure it's large enough to cover at least 2/3 of the upper arm, covering at least 80% of the upper limb. Also, when wrapping the cuff, you want to make sure you at least leave enough room for reading of the stethoscope equal to about 2 to 3 finger widths apart above the antecubital. After firmly placing the cuff above the upper limb, grab the inflation bulb and pump it up to about 180 millimeters of mercury. When doing this, it's important to grab the prongs and make sure they are facing away from you. Once you do that, grab the stethoscope and place it above the brachial artery. The purpose of the cuff is to restrict blood flow. To allow blood flow to the arm, we slowly release the valve between 2 to 5 millimeters of mercury while hearing for the first Korsakoff sound. The first sound recorded is known as systolic blood pressure. Keep releasing the valve until you no longer hear a sound. This will be recorded as the diastolic blood pressure. Once you no longer hear a sound, keep releasing the valve and read the recording to your patient. After you're reading your patient's blood pressure, another one should be taken at least 1 minute after, and an average should be taken between the two. According to the American College of Sports Medicine, individuals who have a resting blood pressure of systolic blood pressure between 120 and 139 millimeters of mercury and a diastolic blood pressure between 80 and 89 millimeters of mercury are considered to have prehypertension and require healthy lifestyle modifications to prevent the development of hypertension. And individuals who have a resting blood pressure equal to or above 140 millimeters of mercury systolic and 90 millimeters of mercury diastolic are considered to have hypertension. This is considered a risk factor for coronary artery disease.